One of the following test is not a liver function test. Option A, urea. Option B, alkaline phosphatase. Option C, total protein. Option D, bilirubin. Answer is option A, urea. In sickle cell anemia, option A, glutamic acid is replaced by valine at the 6th position in the alpha chain. Option B, glutamic acid is replaced by valine at the 9th position in the beta chain. Option C, glutamic acid is replaced by valine at a position in the beta chain. Option D, valine is replaced by glutamic acid at the 6th position in the beta chain. Answer is option C. Blood cholesterol level decreased in option A, diabetes mellitus. Option B, hyperthyroidism. Option C, atherosclerosis. Option D, hypothyroidism. Answer is option B, hyperthyroidism. Condition in which bilirubin appears in urine. Option A, hemolytic jaundice. Option B, obstructive jaundice. Option C, prehepatic jaundice. Option D, none of the above. Answer is option B, obstructive jaundice. Anticoagulant used in the collection of blood for coagulation studies. Option A, potassium oxalate. Option B, heparin. Option C, EDTA. Option D, sodium citrate. Answer is option D, sodium citrate. What is the end product of protein metabolism? Option A, urea. Option B, uric acid. Option C, bilirubin. Option D, creatinine. Answer is option A, urea. What is the method by which creatinine is estimated? Option A, Lieberman-Burchard reaction. Option B, Berthelot reaction. Option C, Jafs reaction. Option D, Carr-Price reaction. Answer is option C, Jafs reaction. Benz-Jones proteinuria seen in option A, nephrotic syndrome. Option B, multiple myeloma. Option C, infectious mononucleosis. Option D, AIDS. Answer is option B, multiple myeloma. Normal value of serum potassium. Option A, 3.5 to 5.4 milliequivalents per liter. Option B, 2.5 to 3.5 milliequivalents per liter. Option C, 5.5 to 8 milliequivalents per liter. Option D, 136 to 145 milliequivalents per liter. Answer is option A, 3.5 to 5.4 milliequivalents per liter. What is kwashiorkor disease? Option A, deficiency of carbohydrate. Option B, deficiency of proteins. Option C, deficiency of lipids. Option D, deficiency of nucleic acid. Answer is option B, deficiency of proteins. Bial's test is used for the detection. Option A, hexosis. Option B, pentosis. Option C, triosis. Option D, heptosis. Answer is option B, pentosis. Selivanov's test for option A, fructose. Option B, glucose. Option C, maltose. Option D, lactose. Answer is option A, fructose. The major urinary excretory product of catecholamines. Option A, 5-HIAA. Option B, 17 ketosteroids. Option C, VMA. Option D, porphobilinogen. Answer is option C, VMA. The inorganic iron that can act as a secondary message for certain hormones is option A, sodium. Option B, chloride. Option C, calcium. Option D, potassium. Answer is option C, calcium. Alkaptonuria causes the accumulation of option A, homogenesic acid. Option B, tyrosine. Option C, phenylalanine. Option D, porphyrins. Answer is option A, homogenesic acid. What is fatty liver? Option A, accumulation of triglycerides. Option B, accumulation of carbohydrates. Option C, accumulation of proteins. Option D, none of the above. Answer is option A, accumulation of triglycerides. What is the wavelength of green filter? Option A, 650 nanometer. Option B, 540 nanometer. Option C 420 nanometer. Option D 590 nanometer. Answer is option B 540 nanometer. The extent to which measurements agree with the true value of the quantity being measured known as option A acceptable limits, option B accuracy, option C precision, option D reliability. Answer is option B accuracy. The reproducibility of test measurement is referred to as option A accuracy, option B precision, option D quality control, option D reliability. Answer is option B precision.